Greetings, everyone, and welcome to the National Board of Forensic Evaluators webinar entitled How to Use Online Assessment Measures for Mental Health Evaluations. My name is Aaron Norton, and I'm the Executive Director of MBFE, and I'll be your presenter today. This webinar is a service that MBFE provides to all of our members, as well as members of our partnering organizations, such as the American Mental Health Counselors Association and several state and local professional associations. For those of you who aren't familiar with MBFE, we're a national not-for-profit organization officially endorsed by the American Mental Health Counselors Association that provides quality training and certification in the specialty area of forensic mental health evaluation for licensed mental health professionals. We maintain 3 specialty credentials, including Certified Forensic Mental Health Evaluator, or CFMHE, Certified Child Custody Evaluator, and Certified Forensic Behavioral Analyst. We also advocate for all appropriately trained licensed mental health professionals to be able to administer and interpret psychological tests. For more information about MBFE, you can visit our website at mbfe.net. So I'm going to also launch a couple polling questions here so we can get a sense of who's in the audience and what you're really hoping that we focus on today. Make sure that we make this very relevant for you. Many of you who have attended our webinars before know how these polling questions work, but you should see on your screen right now your first polling question. Please select all that apply to you so you can select more than one option if it fits. We're interested in your professional identity, so you can choose A if you are a counselor, including clinical mental health counselors, B if you are a psychologist, C if you are a social worker, D if you're a psychiatrist or psychiatric nurse practitioner, and then finally E if you're a marriage and family therapist. So we will give you a moment to choose any of these professional identities that apply to you. 83% of you are counselors. 17% said they are social workers, 10% identified as psychologists, 10% as marriage and family therapists, and 0% psychiatric nurse practitioners or psychiatrists. Okay. So primarily counselors today. The second and final polling question is, how much experience have you had with DSM-5 online assessment measures? You can only select one option. A, I don't know anything about them. B, I've heard of them, but I haven't used them. C, I've used them a little. D, I've used them moderately. Or E, I've used them extensively. I'll go ahead and close this polling question out. Launch our results. 38% said you've used them a little. 34% said I've heard of them, but I haven't used them. 14% said I don't know anything about them. 10% said I've used them moderately, and 3% have used them extensively. Okay, so there's at least a little bit of knowledge and experience with using these tools for most of you. All right. So then we will launch right into our slides here and get going because we have limited time today to be able to explore these tools. So first, there's information about me in the slide in case you are looking for information, and there's also an email address you can see in the lower left-hand corner there, aaron@mbfe.net. So in the event that you have follow-up questions that you didn't ask or didn't think to ask during the presentation, feel free to send me an email at that email address. Sometimes it takes me a couple of days to respond, but I'll be happy to answer some follow-up questions for our attendees today. Handouts, I mentioned how you can access the slides for today by clicking on the handouts link in your GoToWebinar control panel. But in addition, you can use this address. Just type app.box.com/V as in Victor /online assessment measures. And then you will not only be able to get the PDF for the slides, but what I also have in there is a little bit of information about the research and background on these online assessment measures from a journal article. And then in addition, I have a folder that actually contains all of the level 1 and level 2 cross-cutting symptom measures, and it has 2 versions. One version is the entire file, which includes the instructions for the practitioner, but the other version, and I think I labeled that folder handouts, are ones that you can send or give to clients because they do not have the scoring instructions. It's just the part that the client responds to. But keep in mind, you can access all of those measures online, and that's what I'll be showing you today at the APA's DSM-5 website. But additionally, in this handout folder, I have some information I got from the World Health Organization on their disability assessment schedule, which is one of the measures that we'll look at today. And it includes some Excel spreadsheets that you can use to type in client responses to calculate scores more efficiently and quickly than the handwritten version. So all of those you'll find in that folder. And all of those are resources that you can find online for free just by a simple Google search. So why are we covering this topic today? The intention is that if you're in any of these groups, that you'd be able to benefit. Students in various mental health professions and interns who are pursuing licensure are often lack some confidence in their diagnostic abilities, and that makes a lot of sense. They're early on in their career. And these online assessment measures, I think, create some structure and some guidance for students and interns. And by using them at first, they eventually start to get the feel for the diagnostic process, and they accidentally memorize things even. So that they will be relying less on tools at different points in depending on what they're doing. If you are a counselor educator or a clinical supervisor, therefore, you're also going to be interested because you could be using these resources to help your students understand the diagnostic process, or your interns or the counselors that you supervise, and help them in their professional development. If you're a therapist, these tools will be great not only for assessment in a clinical environment, but also for measuring progress as you continue to work with a client. If you're an administrative supervisor, you're probably going to be interested in these tools because they are ways of measuring client outcome, and because third-party payers love it when you can provide some somewhat more objective or quantifiable means of measuring the not only client symptomatology, but also client progress. And then finally, forensic evaluators. Although these tools have some limitations in the forensic arena that we'll be discussing later on, you might be very interested in these tools because they may help guide your clinical interview, and they're great supplements to some of the other tests that you'll be using. But additionally, some of you attending today might be folks who are just beginning your forensic training and your forensic certification process. So for example, if you've applied for the Certified Forensic Mental Health Evaluator credential, you know that you'll have to be creating a sample report that you'll defend in the oral examination. And in that sample report, there's a section for testing. But we often get the question, what if I don't yet have training on testing, or I'm not level C certified for tests, or I'm not competent to conduct certain types of tests, or I don't have access to tests because I'm early on in my career and I haven't made the financial investment in starter kits yet. So what we do is we try to put those applicants and candidates in touch with these free online assessment measures, which are easier to train on and easier to use for several reasons that we'll discuss later on, that they can very quickly pick up on and that they can all access at no cost to them, and then use those for their sample reports. Although in the real forensic arena, you will want to supplement these tests with other types of more sophisticated tests that we'll get to later. All right, so let me, before we go any further, just check in and see if we have some questions to address. Looks like one person is saying that there's a very poor connection. My hope is that that's strictly for that one person. Hopefully everyone else is getting a fine connection. I haven't seen any other concerns yet. So for that individual, I would, it could just be your internet connection, and you may want to look at maybe if there's a way for you to connect through the wall or through a direct line. Looks like everyone else is saying that things are pretty clear. So I think that's an individual problem, unfortunately. But the good news is we'll also be recording this, so there will be a way for you to get any information that you might have missed from a poor connection. And it looks like there are no other questions or comments right now, so we'll go right back into the slides. So first, let me talk about the justification for these online assessment measures. There are a lot of justifications for them, but especially for the cross-cutting symptom measures, one of the justifications is that if you were to go to your primary care physician and get an annual exam, your doctor isn't going to ask you every question about every symptom, about every disorder in existence. There's no way they would ever be able to do that. You'd be there for days. and they certainly wouldn't have the expertise to even diagnose every condition under the sun. Instead, what your primary care physician does is they ask a small number of questions and they check out a small number of things, maybe physically, and only if they get a hit, a positive on one of those screening questions, do they then open up another layer, an additional layer of questions to try and formulate a more specific diagnosis. Well, the American Psychiatric Association believed that mental health professionals should be doing something very similar, that we should start with a small number of screening questions, and then if we get a hit on one of those screening questions, we know to move on to a second layer of questioning to start refining our diagnosis. So I'm going to show you, for example, all the level 2 cross-cutting symptom measures. You would never want to give every client all of those measures. They'd be completing forms all day. You would only give them level 2 measures if in the screening questions on level 1 you get a hit. So it is a very individualized process in that sense. All right, so the online assessment measures, they all come from the DSM-5, very specifically section 3 of the DSM-5, which is entitled Emerging Measures and Models. That's the section where they will put in not only measures that we're going to be talking about today, but they also add conditions that are being studied and debated and considered for adoption in future editions of the DSM. So sometimes disorders make it from section 3 to section 2, which is the section of the DSM that has all of the official identified disorders, the ones that the DSM committees have agreed upon. So in section 3, these are the different measures that you'll see. First, you'll see cross-cutting symptom measures for identifying symptoms that are part of diagnosis. And there are 2 levels of cross-cutting symptom measures. Then you'll see severity measures that help us to identify how severe somebody's disorder might be on a spectrum. Third, you'll see disability measures, and these will be your measures to help determine how does the person's symptoms affect their ability to function socially and occupationally and relationally, and in terms of self-care, because that's part of diagnosis also that we often miss sometimes. We focus so much on symptoms that we don't focus enough on functioning. Symptoms aren't enough for a diagnosis. You have to be able to demonstrate that the person's symptoms are causing clinically significant impairment or distress. And that's where these disability measures can come in handy. But there are also some new personality inventories based on a new hybrid multidimensional model of personality disorder diagnosis that hasn't yet been officially adopted, but in all probability will be adopted into the next DSM. They actually tried to adopt it in the DSM-5, but because of controversy at the last minute, they decided to just park it in section 3 for now and let people kind of ease their way into it over the next several years. But the writing's on the wall with these new personality disorder diagnostic processes, I believe. And then finally, you will see 2 measures that deal with early development and home background. One of them is called the Early Development and Home Background Form, which is for children. And then the second is the Cultural Formulation Interview, which I think is very interesting and very helpful. And that tool will help you to help you to identify whether somebody's symptoms and symptom presentations are culturally appropriate or not. Because in some cases, you won't even be diagnosing if they're culturally appropriate and accepted reactions. So let's start with our cross-cutting symptom measures, the very first type of measure that you'll see. These, like I said, are modeled on general medicine's review of symptoms, and they serve as an approach for reviewing critical psychopathological domains. Level 1 screens for 13 different clinical domains for adults, or 12 for minors. And so they're like on the adult version, for example, there are 26 items that are lumped into 13 categories. And then if you get a hit in one of those 13 domains, you move on to level 2, where you do a more in-depth assessment of just the domains that you got a hit on from level 1. So let's pull out of the slides for just a moment and actually show you what this looks like online. So what I've done here that you'll see on my screen is I went to dsm5.org. It doesn't look like that because you automatically get redirected to a different URL. But if you type in dsm5.org, then this is where you end up. DSM, the number 5.org. And if you scroll down here, you will see on the right-hand side, online assessment measures. So when you click on online assessment measures, you will be redirected to this page. And here we start off with our level 1 cross-cutting symptom measures. Notice that there are 3 versions for the level 1 measure. There's the adult version, which is also available in the DSM-5. Then there is a parent/guardian rated version for children aged 6 to 17. This is one that the parents will complete on the behalf of or about a child who's a client. And then finally, there is a measure for adolescents, actually for ages 11 to 17 to complete for themselves. And what I will often do when I'm working with minors is have both the parents do the parent version for their child and have the child, if they are an adolescent, do the measure for themselves, and then also compare the results with each other. So to keep things simple, let's just pick the adult version here for a moment. We'll click on it, and then what you can see is a PDF has automatically been downloaded in my browser. So I'll open that PDF, and page 1 of the PDF is always your disclaimer, and then it's got information about the measure itself. And then here is your actual DSM-5 self-rated level 1 cross-cutting symptom measure, the adult version. This is the only form that you will ever hand to a client, if you even hand it to them at all. It's a 1-page form that has 23 items in 13 different categories. Then page 3 is instructions for the clinician, so you never want to give this to a client. Now, what I do is when I have therapy clients, actually all clients pretty much, I have them fill out this form in the lobby as part of their intake packet before they even see me. It saves me a lot of time, and especially when doing therapy with clients, I really like to minimize the interrogation that can happen in the first appointment when you're asking a million questions to formulate a diagnosis. I like to guide my questions to and have a screening process already in place, so I can also focus on what I think is most important in the therapeutic interaction, which is to establish rapport and a therapeutic relationship in addition to formulating an assessment, focusing more on what's relevant to the client and focusing less on what's not relevant to them. So I'll usually have them do this in the lobby. For the measure 1, level 1. If you have an EHR system or a client portal, you may be able to share this measure with them before they ever come in, so they can complete it before they come in for their appointment. I've noticed it's extremely common to see that both primary care physicians and other medical specialists will have you complete forms like this before they even talk to you. And that it makes a lot of sense, I think, for us to do the same. So you'll see this is a very here and now cross-sectional questionnaire, because they're asking you to think only about the past 2 weeks when you're completing this form. So it says, during the past 2 weeks, how much or how often have you been bothered by the following problems? And then you have your 23 questions, and then you have a spectrum of answer possibilities up here in the upper right, ranging from none to slight to mild to moderate to severe. And the client will circle whatever number best fits for them for that question when considering the past 2 weeks. So the first 2 questions in domain number 1 are little interest or pleasure in doing things and feeling down, depressed, or hopeless. So anybody want to guess by typing into their questions box what family of disorders we are screening for with these 2 questions? Go ahead and type your response into the questions box here. You guys are quiet. No one has submitted an answer yet, it doesn't look like. Okay, there we go. Finally, people are chiming in. So Sherry and Dennis and Kirk have all said depression, and you are absolutely right. These first 2 questions are obviously screening for depressive disorders. Now, the idea is this. If you look at the diagnostic criteria for depressive disorders, if the client circled 0 for both of these, and assuming that they were insightful and honest in their self-report, then you can automatically rule out depressive disorders. So no need to be asking a bunch of questions about depression during the clinical interview. I know that there's a couple ifs built into that, but you would only be considering depression if you got a 1 or higher in this category. Our question number 3, feeling more irritated, grouchy, or angry than usual, is domain number 2. Now, this one's not actually a disorder family. It's just literally anger, I think it is. It's just getting a sense of, are they presenting with a lot of anger or not? But domain number 3, sleeping less than usual, but still having a lot of energy. And the second question for that domain is starting lots more projects than usual or doing more risky things than usual. Anybody want to guess by typing into their questions box? Exactly, you guys are already guessing. So yes, we're screening for mania here, for the possibility of bipolar and bipolar related disorders. So everyone is on the button and responding to that question. Next section, section 4 has 3 questions: feeling nervous, anxious, frightened, worried, or on edge, feeling panic or being frightened, avoiding situations that make you anxious. You all could probably guess, I'm sure, that these are screening for anxiety disorder questions. This is looking for the possibility of 1 or more anxiety disorders. Section 5 has 2 questions, 9 and 10. This might be a little bit harder for some folks. Unexplained aches and pains. Examples: head, back, joints, abdomen, and legs. And the second is feeling that your illnesses are not being taken seriously enough. Anyone want to guess what disorders we're talking about here? So far, we've got a few responses. Everyone has said somatic. 1 person said malingering. So yes, these are somatic symptom disorder screening questions, numbers 9 and 10. Question number 11, thoughts of actually hurting yourself, is a suicidality screening question. Then we go to section 7, or domain 7, 2 questions: hearing things that other people couldn't hear, such as voices even when no one was around, and feeling that someone else could hear your thoughts or that you could hear what another person was thinking. And already you guys are typing in psychosis, psychotic disorders. You're absolutely right. The 14th question, category number 8, problems with sleep that affected your sleep quality overall. Anybody want to guess what we're screening for? Think DSM-5, section 2, and all the different chapters of disorders in section 2. Sleep disorders, there we go. Some of you had some other guesses, but the right answer is sleep disorders. And then domain number 10, items 16 and 17, unpleasant thoughts, urges, or images that repeatedly enter your mind, and feeling driven to perform certain behaviors or mental acts over and over again. And you guys are already typing in OCD. That is correct. These are your OCD and OCD related or OC related disorders. Then we go to, I skipped one. I skipped question number 15, problems with memory, learning new information, or with location, finding your way home. So for question 15 there, think section 2, DSM, and all the different chapters that are families of disorders. Which family of disorders do you think we're screening for with question number 15? No guesses yet. All right, Krista, you've got it right. It is cognitive, neurocognitive disorders, very specifically, that we are screening for with that question. Number 18 in section 11, feeling detached or distant from yourself, your body, your physical surroundings, or your memories. We have dissociative disorders that people are guessing. Absolutely right. And then we go to, this one might be hard for some people to answer, domain number 12, questions 19 and 20. Not knowing who you really are or what you want out of life, not feeling close to other people or enjoying your relationships with them. What are we screening for with these 2 questions? So we got lots of different answers. So people are guessing a lot of things. Some people said adjustment disorder, some said PTSD, some said personality functioning, and some said personality disorders. Personality disorders are indeed what we're screening for with these 2 questions. And then finally, our domain number 13, Should be pretty obvious. Questions 21 through 23 have to do with alcohol consumption, tobacco use, and the use of any illicit drugs or non-prescribed medications. And that's where we're screening for substance use and substance use disorders. Now, one thing you may already be noticing, hopefully you're noticing, is that there are other disorders that aren't included in this measure at all. So for example, you don't see anything here that deals with gambling, a gambling disorder, for example. So there are some disorders that are not captured, unfortunately. You don't see any ADHD screening questions either. So there's no neurodevelopmental disorders that we're screening for on this. So that is one limitation to the cross-cutting symptom measures, is it only covers 13 domains that are commonly encountered in our treatment environments. But there are some disorders that are not included. So we'll want to look for other measures for those disorders. And I will be showing you those other disorders, those other measures later on that we can find from other resources. So anyway, if we move on to page 3 for the level 1, we see that we have our instructions for clinicians, and they tell you how to score and interpret, and they tell you with each of these domains what scores would indicate that you should move on to a level 2 measure. Now notice that there are no level 2 measures for some of these, like suicidal ideation, psychosis, and memory. There are some severity measures on the website for things like psychosis, but not a level 2. So you may be looking for a different measure or just doing your standard diagnostic interview to assess further in those categories. So let's move on then to level 2. Let's imagine that this client had a hit in the domain for OC or obsessive compulsive related disorders. If that were the case and they were an adult, then we would go to level 2, repetitive thoughts and behaviors, as instructed by page 3 of the level 1 measure, and we would click this measure, which is actually adapted from the Florida Obsessive Compulsive Inventory Severity Scale. So we'll download that measure. And again, page 1 is your disclaimer and your general information about that particular test. And it's just a 1-page questionnaire for the client, followed by your clinical instructions for how to score and interpret this page. So something I want to point out here is you have options for how you can move on to a level 2 measure. I sometimes, if we didn't have time to, we had a very busy initial appointment, we had a lot to discuss, I might give them the level 2 at the end of the appointment. They can do it in the lobby while I'm meeting with my next client. In some cases, when I'm doing an extensive evaluation, what I wouldn't do for a forensic evaluation is ever give somebody a test to take home or have them do it on their own, because you never can know for sure if they're the ones doing it. And you also can't control the testing environment to make sure it's an appropriate environment. But what I do a lot of times is I'll actually do the level 2 measure in the room with the client, because I have them all on my iPad. So I'll just pull it up and I'll start writing and circling things and asking them questions. They don't know that I'm administering a questionnaire necessarily. It looks just like part of the clinical interview. So here you will ask them these questions. On average, how much time is occupied by these thoughts or behaviors each day, and so on, and they'll mark their responses. Or if you're doing it verbally, you'll give them maybe some written instructions for which number to give you in response, and then they can call out a number every time you ask a question. It depends on how you want to use your level 2 measure. I tend to prefer to have them do it in writing, though, separate from the clinical interview, and use it as an additional data point that supplements the clinical interview. So if you gave them the level 2 measure, and let's say that they came up with a higher score that was maybe, let's go with an average score of 2, then we would say that these are pretty severe symptoms. So the level 2 measure helps you to really formulate your diagnosis by looking at specific symptoms or probability of having a disorder. Now, let's say that you have a level that you want to go beyond the level 2, and you want to, I guess a good example would be depression. The level 2 depression measure doesn't really have specific symptoms, DSM symptoms of a depressive disorder, but what it is a probability conclusion. If a person answers these questions a certain way, then there's a high probability that they have a diagnosable depressive disorder. What I then would do is I'd move on to our next category, the disorder-specific severity measure. So let's go back to our PowerPoint here, and I'll show you those. But before we do that, we have a question. And I'm sorry, I could be pronouncing your name wrong. I think it's Nidian or Nidian. The question is, I missed some info due to connections, but how do you get these screenings? You go to dsm5.org. That's dsm, the number 5.org. And then you click on Online Assessment Measures on the right-hand side. So it's dsm5.org, and then click Online Assessment Measures. All right, so back to our slides. We covered our cross-cutting symptom measures. Now we go on to our disorder severity measures. These are very disorder specific, and they help you to determine the severity of the symptoms. So let's assume that you have done your level 1 and level 2 in your clinical interview, and you've already decided this client definitely has a depressive disorder. But now, and let's say more specifically a major depressive disorder, but you now really want to look at severity. But how severe is their depressive episode? Here's where this measure will come in very handy, the disorder severity measure tool. It also can be helpful when you have a client who's just shy of meeting the diagnostic criteria for a disorder, and you're considering an other specified or an unspecified diagnosis. So for example, let's say a client came in and they said that they were feeling significantly sad, down, or depressed more often than not, and that they were having a difficult time concentrating, that they were losing interest or pleasure in things they normally enjoy, and that they were having some passive suicidal ideation. They've been thinking a lot about death and dying. They find it very hard to get out of bed. They spend more hours in bed than they ever did before, but they feel way less rested than before. And they're fatigued during the daytime, no matter how much sleep they've had. And they're also eating a lot less than usual because they lack an appetite. Well, that sounds like a major depressive episode, right? But what if the client told you, and this has been going on for 12 days? Well, some of you know that for it to be a major depressive episode, it would have to be 14 days, 2 weeks of those symptoms to call it a major depressive episode. So they've come into your office, and sadly, they're, well, depending on how you look at it, they're 2 days shy of meeting the diagnostic criteria for a major depressive disorder. Well, what I would do in a case like that, if I decided, but they're experiencing clinically significant impairment or distress, I don't see this going away in the next 2 days, and they're here now and they need help now, then I would probably diagnose them with a depressive disorder, comma, other specified, comma, does not meet full duration criteria, which is my way of denoting why I'm not diagnosing them with major depressive disorder quite yet, but I'm still going to call it a depressive disorder. Well, let's say the insurance company, they never do this for me, but let's say that an insurance company or a third-party payer said, well, we want more information about this other specified diagnosis. Then if I had done a disorder severity measure, I could show, look, they have a pretty severe symptom presentation for depression, regardless of whether they're just 2 days shy of meeting the technical diagnostic criteria. And that would be one way to sort of back up that they still are disordered and they still need the intervention that I'm providing. So let me show you an example of one of these measures. Let's click on disorder-specific severity measures. Let's look at depression and notice how they're using a variation of the PHQ-9. Many of you know this tool because many of you have already used it before. It's a one-page questionnaire, and if you look at these items, these are basically the symptoms, the DSM symptoms of a depressive disorder. And the client can circle based on the past 7 days only, so it's just a one-day snapshot, whether they didn't experience these symptoms at all, or they did for several days, more than half the days, or nearly every day for the past week. And so let's say that client who was on day number 12 of their major depressive episode-ish symptoms, but they've got a lot of severe, they've been troubled by these things nearly every day, and they have a lot of symptoms. That helps to justify that you're still diagnosing them. And then here is your score range that tells you, is it mild, moderate, moderately severe, or severe depression? Now, you also could re-administer this tool periodically when you work with the client, showing that their score is reducing with time, and therefore they're making progress clinically, and that can justify continued care. But let's say they still have symptoms, and that can justify that they're continuing to work with you. So, having covered our severity measures, let's move on to our disability measures. This is one that counselors, in my experience, are a lot less knowledgeable about. So for those of you trained on the DSM-4, and dare we say that some of you were also maybe trained on the DSM-3 or maybe even the DSM-2, you know who you are, because you've been around that long in the field. We used to have a GAF score, a Global Assessment of Functioning score, and it was this number that we would try to use to quantify how severe a client is, and there were many, many problems with the GAF score. The way I was trained to do a GAF score was in my first job. I was only a bachelor's level counselor working in a treatment center, and I was doing my first psychosocial update, and at the end it asked for a GAF score, and I asked my clinical supervisor, how do I do a GAF score? And I kid you not, this is what they told me. They said, well, go to their chart and see what the psychiatrist gave them as a GAF score when they came in. Then increase that number to show that they've made progress. But don't let it hit this high, which I think was like 70 or something, because if it's that high, they'll say that they're doing too good to stay in this residential program and they're not done with their treatment yet. Okay, well, that is a complete misuse of the GAF system. That basically was a game that people were playing just to justify what they were already doing, not an assessment measure. So there was very poor inter-rater reliability with GAF scores. Two people could meet with a client and come up with dramatically different numbers. The number was being abused. It was too dichotomous. So with the DSM-5, they said, we're scrapping it. We're not replacing it with anything, but we are recommending that counselors now consider an additional measure called the HUDAS 2.0. That's the World Health Organization Disability Assessment Schedule. And this is your tool that is used to assess a client's ability to perform activities in 6 different areas of living. So here we're getting a sense of how does the person's symptoms affect their ability to function in the world, socially, occupationally, and in terms of relationships and self-care. Now let me pause here for a moment because I do see I see some comments, there's some laughter, and then that's exactly what I was told back in the day. All right, so you guys know how we got trained poorly on how to do the GAF score back in the day. All right, so so these are your 6 domains, by the way. They are understanding and communicating, getting around, self-care, getting along with people, life activities, and participation in society. So let's take a look at this measure and see what it looks like. We have disability measures right here. We click next to it. You've got 2 versions. There's a version that is 36 items that can be self-administered by the client. And then there is a proxy administered. That means that someone else who knows the client very well is answering based on their observations. As a side note, when I'm doing forensic evaluations that might relate to disability, like well, this is kind of a clinical / forensic eval, but I did an emotional support animal letter evaluation last week. And so I had the client do the HUDAS for himself, but I had a family member who knows him well do the HUDAS from what they see in the client. And then I compared the answers to see if I see some degree of consistency in terms of the way that the client's symptoms are reportedly interfering with their ability to function. So it's kind of nice to have both of those available. Now, if you go online to the World Health Organization's website and you just Google HUDAS World Health Organization, then you'll see that they have other versions available that are shorter versions and that sort of thing. But these are the versions that the APA adopted into the DSM-5, and they're the versions I use. You'll also see that although you get, let's just download one of them here. Actually, let me, we have our page of disclaimer and then basic information. And this one's actually a 2-page client questionnaire. So the client will get 2 pages, and they are asked to think about the past 30 days and to think about think about any diseases or illnesses or other health problems that they have, and then circle 1 answer per item for how those disorders are affecting their ability to function in the past 30 days, how much difficulty they've had with these functions. So we've got understanding, communicating, we've got various items there. So we basically have our 6 different domains, and they're going to circle on a spectrum how much they believe that they've had difficulty with these things in the past 30 days. And then you have your counselor instructions for scoring. Now, what I like, again, is to use the Excel spreadsheets, which I have. You'll see that I have them in that box folder that I gave you a link to, because then it automatically calculates percentile rankings for me based on the client's responses. So that would be a way for you. Now, when you diagnose using the DSM-5, you have the option of including WHODAS scores in your diagnosis. A lot of people don't know that, but you know how you used to have your 5 axes and then you'd have your GAF score at the bottom of your diagnosis? Well, you can do the same thing with the WHODAS with the DSM-5 diagnosis. You can throw that into your diagnosis, your WHODAS score, if you want to. It is optional. But if you're really thorough, then you can add that. All right, so let us move on now to our next category, which is our personality measures. This gets a little bit complicated, and I'm not going to go into the new personality disorder diagnostic system because that would take a long time, and I'm even a little unclear about some things with it, but I'll give you the basic gist here. With the new model that is being used worldwide, and that I'm sure will probably end up in the next edition of the DSM, like I said, they were so close to putting in the DSM-5. They intended to put it in the DSM-5 actually originally. So a diagnosis of personality disorders is based on 2 determinations with this new model. Number 1, we assess the level of impairment in personality function in 2 different domains: self, which includes identity and self-direction, and interpersonal, which includes empathy and intimacy. Notice how the 2 items that screened for personality disorders in the DSM cross-cutting symptom measure level 1 questionnaire dealt with these 2 domains. So if we get hit on one of those 2, we know to start assessing for personality disorders. Now, the second piece to a diagnosis of a personality disorder using the new model would be an evaluation of pathological personality traits. So they have identified 5 trait domains that are disordered personality that exist universally with human beings, cross-culturally. And those 5 domains are composed of 25 trait facets. I think it's 5 facets per trait domain for a total of 25 trait facets. We can't get into all that today. All I am going to tell you today is that there is a new handy dandy measure that you will find under personality assessment inventories or personality inventories. We've got a few versions. We've got a brief version that just focuses on the 5 domains, but not the 25 facets. And then we've got what is probably far more useful is the more extensive version, which is this one, I think, for adults. And we've got an informant. So like right now I'm doing an evaluation with a woman who is very defensive, and she kind of minimizes and underreports. But other people in her life and a physician and others think that she has a personality disorder. So if you want to guess, she did the self-rating form and was basically like, I have no problems with anything. And then when others filled this out, they said, oh yes, she has problems with things. And there's kind of a concurrence among other people on what those problems are, even though she's denying them all. So this informant form can be helpful if you were going to use this measure as a supplement to other measures and say a forensic evaluation. But at any rate, let's pull up the form and let's assume that you have a client, like a lot of therapy clients are, who is pretty motivated to be honestly disclosing to you, and that they have enough insight that they could probably pretty accurately respond to things. Look at how long this is. It's got, goodness, 220 items that fit into those 25 facets, which fit into those 5 domains. And then you have all the facets here, like eccentricity, emotional lability, grandiosity, and so forth. And then you have your trait domains, the 5 domains of negative affect, detachment, antagonism, disinhibition, and psychoticism. And in the new model, you would create personality disorder diagnoses du jour based on various combinations of these different of impairments in different facets and domains. And then here are your instructions for the clinician, like you see on all the other measures. So for time purposes, that's all I can really tell you about the personality inventories for right now, I think, because that's something we all just have to learn. But let's move on to the next category of online assessment measures. We've got early development and home background. So this includes the early development and home background form, which is when you are evaluating children only, and it has 3 areas of focus: early development, early communication, and home environment. These first 2 are, I think of them as screening for possible developmental disorders and developmental delays. And then this helps us to understand the context, the social context of the child. But then we have this other really neat tool that I like a lot called the cultural formulation interview. I like it for many reasons. One is it really helps us to be more competent with our multicultural assessment, because no one, I mean, you could try and study every culture in the world and you will never be able to truly know all of the cultural norms and all of the exceptions and variations of those cultural norms in any culture. Even no matter how hard you try. But what you can do is explore with the client their perception of how their culture and their background factors into their presenting concerns. And that's what this tool really helps you to do. Because remember, when you're diagnosing for many disorders, you also factor in, but is this kind of normal in the context of a person's culture, even though it may not seem normal here in this particular culture? And that's at least something to consider. And it's also important to consider when you think about your treatment interventions, being aware and mindful of the client's culture and how that could impact their treatment. So let's take a look at these measures real quickly here. Here we go, early development and home background, our final category. For children ages 6 to 17, we have the parent or guardian background form, and then we have the form that the clinician can use for their own ratings of what's going on with the child based on observations and interview. And if we just open one of those up real quick, it's a 1-page questionnaire. This is the one the parents fill out. And here's your categories: early development, so were they born prematurely and those sorts of things, early communication, and then finally learning about the home environment, understanding the context within the household. Then we have our cultural formulation interview, which again I think is really neat. And it's basically just like a structured interview of specific questions that you can ask a person during the interview. You can ask things about what brings you here today, and then when you get the information, and you can ask, people often understand their problems in their own way, which may be similar to or different from how doctors describe the problem. How would you describe your problem? If they're very symptomy, you can ask them for their description. You can ask about how their family, friends, or others in their community describe the problem, and how the client would describe the problem to them. You can ask the client, what really troubles you about this problem? And then you can ask them about their perception of causes. Why do you think this is happening to you? You might have a client, for example, who is particularly religious, and they conceptualize the problem as being a form of spiritual warfare. Well, that's really good to know about when you're working with a client. What do others in your family, your friends, or others in your community think is causing your problem? So what do others think is the cause? Are there kinds of support that make the problem better or worse? So who do they reach out to in their community or in their family? And are there stressors in their community that make the problem worse? And so on. I won't go through all of these items, but you get the idea. It's lots of questions to help you to, it's more of a qualitative measure, just like the early development form that we just brought up. These are more qualitative measures to help you understand the individual and their context. So those are all of the online assessment measures in a nutshell, the brief version. So I want to move on to some other tools. Before I do that, do we have any questions on the online assessment measures? Oh, wow, we only have 7 minutes left. So tell you what, how about this? Instead of, you can type in your question if you want to, but I'm gonna go ahead and just really quickly move on to the other resources. So, like we said earlier, these online assessment measures only cover 13 categories of disorders, and there are others. So there are additional tools available to you. For example, SAMHSA, the Substance Abuse and Mental Health Services Administration under the U.S. Department of Health and Human Services, has a listing of online screening inventories at their government website. And they've got categories: depression, drug and alcohol, bipolar, suicide risk, anxiety, and trauma. I have found the trauma screening tools to be kind of neat and helpful. Look at our DSM-5 online assessment measures that we've been talking about are all right here. Healthy living questionnaire. There's just a lot of really neat tools on this site. So that's certainly one to be aware of if you're looking for some commonly used free tools. And Scott D. Miller has his outcome rating scale and session rating scale, which are great, simple measures that really help to collect client feedback and get a sense of what might help the client to improve and what the client thinks about the therapist and the treatment being provided. And if you would like those tools for free, you can visit Scott D. Miller. You have to go to the measures licensing and you have to register to get the license to use the tools. They are wonderful tools. And then JCAHO has a listing of like a gazillion different instruments. They don't have links to those instruments necessarily, but they have information about them so that you could Google them and find out if they're available for free online or not. Now, there are some ethical considerations and limitations. Using the YAMCA Code of Ethics as an example, we need to choose reliable, valid, and appropriate measures. There's a lot of research on the reliability and validity of the measures that we've covered today, and the ones that we didn't cover. So I didn't have time to really go into great detail about those items, but you can look that information up later, and I have some in the folder. You need to be able to discuss limitations of generalizability of the results with clients and the imperfections of these tools. You have to be able to justify the logic of the tools you choose, avoid the outdated and obsolete ones. That's why I kind of like these measures, because they're updated. You have to be able to provide the client with information about the rationale and how much time it takes to complete them and how you're going to use the data. Provide an appropriate testing environment, and you base your diagnoses on multiple sources of data whenever possible, and ensure that you are competent in tested administration and interpretation. Some of the limitations for those measures we've talked about are that none of them have validity scales built in. So all of these tools rely on the client to be accurate and insightful and open and honest about what's going on with them. And many of you know that's not always the case. So let's say you're doing a forensic evaluation when clients there might be very strong threats to validity. I would never use these tools only. I would use tools that have validity scales built in, like the personality assessment inventory or the SIRS-2 for malingering or whatever. And then these tools I would use more to guide my clinical interview with the client or supplement to those tools. But again, for those of you who are pursuing certification, if you do not yet have access and competency in the more sophisticated tests, then these are appropriate measures to put in your sample report while you're pursuing certification, and then you can do additional training on other appropriate tests to use. And when you give clients big giant stacks of forms and stuff, and sometimes that can be overwhelming and irritating, but I think this system helps to minimize that because you're only using what's appropriate given the screening, the initial screening. So that is it for these slides, and now we can cover questions. So I think it's Nidian has asked, are these measured in Spanish? That is a great question, and I do not know the answer to that. I didn't see Spanish versions on the DSM-5 website, but maybe sending a message to the website folks, a contact us question, they might be able to answer if there are Spanish versions. And I know that for some of these tools, there are Spanish versions. Like, for example, on the SAMHSA Screen Tools website, one of the tests on there for substance use, I think, is the audit. And I know that's available in Spanish. I've seen it in Spanish. But you might have to do some Google searches and things to try and find out if it's available in Spanish, and if so, where you can get it from. The WHODAS 2.0 is available in multiple languages because it was created by an international organization. I would be shocked if they didn't have a WHODAS 2.0 Spanish version. I just don't know where to get those. I wish I could tell you more about that. Next question is, in terms of online measure. Okay, gotcha. So I think that's a follow-up to Nidian's question. Angie says, thank you, well done, really enjoyed the session. And I appreciate that. If there are no other questions right now, then I need to quickly give you just a couple last pieces of information here. And remember, you can send me follow-up questions if there's something that you didn't get to ask today or you think of something later on. But remember to complete that webinar evaluation form, which will appear on your screen after I'm done talking. And if you miss it, there'll be a second opportunity and a follow-up email that you'll get in about an hour. And our next webinar is entitled How to Conduct a Comprehensive Mental Status Examination, which is on Friday, March 1st from 3 to 4 p.m. Eastern Time with Dr. Norman Hoffman. And you can visit our website at mbfe.net. That is one of the most messed up sections in reports that we've seen, is the mental status exam section. Many clinicians are not being appropriately trained for the mental status exam. So I'd strongly encourage you to check out that webinar with Dr. Hoffman so that you can learn how to do a really good mental status exam. Now, Nidian or Annette has asked, may we have the PowerPoint? So again, you can go to your GoToWebinar control panel, click on the triangle symbol next to handouts and download the PowerPoint, or you can use the link that I gave you earlier to download it and some additional items. Here it is. The link is app.box.com/v/online assessment measures. That should also answer Nidian's question about the slides being available. And Lisa says, mental status workshop not online. I don't really know what you're saying, Lisa, but I will show you all how to get to that, that training online. You go to mbfe.net and then you go to training. Notice that we have 3 training categories. There's a live training events, webinars on demand, and home studies. This will be a live training. We'll later convert it probably to an on-demand. And then if you scroll down, here it is, how to conduct a comprehensive mental status examination. So you would click on that to get more information and to register. I think that should take care of your questions. So I wish you all a wonderful weekend. It's been great spending time with you today. I hope this was a little helpful lightning round on online assessment measures, and we'll be posting the recording, and we will see you next time. Have a good one.